From the News Channel 5 Network, this is OpenLine.
Well, good evening and welcome into Open Line. I'm Chuck Long, going to be here with you for the next hour. It's always good to be with you here tonight, especially it's Ask the Expert. And tonight we're going to be talking about your teeth. And I know a lot of you will have questions and comments. We're talking with Endodontist Dr. Richard Horwat, and I know you always look forward when Dr. Horwat is with us. You know, there's so many questions that you have when it comes to your teeth, whether it's a root canal, whether it's sore, whether it's gums, a lot of things to discuss. And Dr. Horwat, always great to have you here. We've got a lot to talk about as always.
Yeah, always nice to be here.
Now, tell me too, or actually to initiate, if someone happens to be tuning in for the first time on one of our Ask the Expert evenings, when it comes to the endodontist, when does someone in particular normally go see the endodontist?
Most of our patients, almost all of them, as a matter of fact, come in by referral. They'll go to their general dentist. They'll either have a tooth that might be causing them discomfort, or they may not have any discomfort at all, and they may notice on the x-rays that there's some type of infection up there. And at that point, usually the general dentist will refer them to us.
And when someone comes in, and I know this is, we've talked about this before, but I think people often, I was watching a morning news show this morning, and they were talking about the fear of the dentist. And there is a fear of root canals and that kind of thing. And yet root canals have come so far from, I think, what a lot of people are used to thinking about maybe 10 years ago, 20 years ago. So kind of explain that process.
They have. You know, root canals, it's advanced quite a bit. You know, I think that maybe 30 years ago, maybe the anesthetics weren't as strong. I know that root canals definitely have a bad rap. I did general dentistry for about 9 years as well. And I can remember times where I would give a patient an amount of anesthetic, and they may even be feeling a filling or something like that, just a little bit. We were able to usually get through the procedures, but now that I'm doing root canals, I really don't have that problem. Now most of my patients, they're profoundly numb. You know, we give them plenty of anesthetic. On a standard case, I can probably make almost all of them to where the patient really doesn't feel me even going in there and getting them numb. I'm going to say most of my patients don't feel a thing from the injection all the way to the end of the procedure. Every now and then, though, you know, you do have a patient with a larger infection. There's a swelling in there. There's a lot of infection or inflammation, and sometimes it's a little bit tender, and we just kind of have to take our time with it. We can still make it pretty comfortable. Worst case scenario, no, we can always give someone nitrous or oral sedation or IV sedation if we have to go that route. But even under those circumstances, most of the time I'm able to just take my time and get them numb. And usually there is minimal discomfort. Root canals have come a long way, for sure.
And that is always good to know. And as always on Open Line, this is your forum. We love it when you call with a question, with a comment. The number is right there on your screen, 737-7587. And we're going to go to the lines. If you have a question or comment, though, give us a call as quickly as possible so that we can get you in line and get those questions answered. And I know a lot of you will have them when it comes to your mouth and your teeth and the best care for them. So right now we're going to the line. Frida is on the line with us. Good evening, Frida. Do you have a question for Dr. Horwat?
Yes, I have a question. How y'all doing this afternoon?
We're great. How are you doing?
I'm fine.
Good.
I had a problem with a dentist where I was a single parent, so I've really been working since, you know, been a single mother. But I went to the dentist, and he talked so bad about my mouth, and he sent other people in there to look at my mouth to tell them, if your mouth's going to look like this, if you don't take care of your teeth. Could you tell me, he don't do that, do he? I just had a bad experience, and I'm scared of the dentist now.
No, that's usually not my, you know, I don't think that's maybe the best way to go about it. But, you know, it gets kind of difficult. There's times where patients, when I did general dentistry, I really don't have that problem as much anymore. But when I did general dentistry, you know, patients would come in, and there would be a lot of neglect there sometimes. And it does get frustrating from the clinician. Your clinician may have had a bad day. I mean, he probably could have explained things a little bit differently to you. But sometimes when we're trying to fix a problem, if the habits don't change, whatever we're going to do is going to fail anyway. And, you know, it's really hard to give someone that tough love. You know, patients come in and you kind of do have to tell them the way it is. If you don't, then you're being negligent, I think. And it gets kind of tough. You know, we have patients that come in all the time. I have a patient that tell me, or would tell me back in the day that, you know, I'm brushing my teeth twice a day, I'm flossing 3 times a day, and I look in their mouth and I can tell they haven't brushed in 3 weeks. Everyone does it every day. Everybody flosses every day. And, you know, you might want to find a dentist that can communicate better with you, or someone that works with your personality a little bit better. But they, you know, they may have just been trying to tell you like it is. Unfortunately, I apologize that they went that route with you.
Yeah, I just didn't like that he sent the patients that was waiting on him to come back there and look in my mouth. And I thought that was very unprofessional.
He actually brought patients. He brought patients or staff back to take a look.
Not the staff or patients. It was 2 patients waiting on him also. And he had them come back there, and he was talking like that in front of the patients who was going to be seen by him, too.
Wow, that's quite the story. You know, I don't even know how to respond to that. I don't know. I wouldn't have done that. I certainly don't. I work 1 patient at a time. Usually if I have another patient in a chair, it might be one other one. But they have to get my undivided attention when I'm doing a root canal. When I'm doing general dentistry, I could do things and take a break, and I can have staff come in and do certain things while I go and address other concerns. But most certainly, I don't think that they should have brought patients back there to take a look. I'm not exactly sure. You know, I'm sure if I asked a dentist about it, they might tell the story a little bit differently. Not to, you know, take any credibility away from what you're telling me, but that certainly doesn't sound like the smartest way to do things.
Yes, but thank you so much. I was just trying to make sure, because I hadn't been back since that happened, because I was so embarrassed, and it really hurt my feelings.
I'm sorry.
Well, and the nice thing is, Frida, there are a lot of dentists out there, so and I would say the majority of them are very concerned and caring and that sort of thing, so hope you find one of those.
Hey, thank you so much.
Right.
You got it.
Have a great evening.
You too.
Thank you very much. Good night. All right, going back to the lines right now. Patricia is on the line with us. Good evening, Patricia. Do you have a question or a comment for Dr. Horwat?
Yes, actually I do. I'm just, you know, would like to seek some of his wisdom, if I may. I went to see a good friend of mine in California and had to fly. And at the time I had a toothache. I wasn't certain about, you know, what it was, but it was a very bad toothache, and it got worse and worse. And then, so while I was there, I called a couple of dentists, and they said, well, it sounds like, you know, you could have an abscess of some type.
Okay.
And so I went ahead, in the next couple of days, I made reservations, and I flew back home here and went to my regular doctor, and he, you know, he checked it and so forth, and he said, I don't want to touch it because it is so infected. And he said, and it's happened over a very short period of time, which I thought was odd to me, that, you know, it would be a short period of time. But long story made short, he sent me to someone for treatment, and you know, he looked at it, opened it up a little bit, and then said, you have such severe infection, we have to get the infection out before we can do anything else. And so we did that, 10 days worth of antibiotics. Then I went back and, you know, did the rest of the work and so forth. And I guess my question to you, sir, is that was I just that ignorant? I mean, you know, I thought I was taking very, very good care of my teeth, but apparently I wasn't, or I overlooked something, or can that just happen? I mean, can you have something that is right on the cusp of becoming a serious problem and go, you know,
blow up on you?
And not realize it until it's almost too late.
You can. You know, you have different types of abscesses. You have some called acute abscesses. You have chronic abscesses. There are times where I've had patients where It's really hard without looking at x-rays and looking in your mouth and for me to kind of have an idea of what's going on. I'm trying to draw a picture of what I think might be going on. If you came back here, if you went to the person you went to in California, they may have seen the abscess or saw something on an x-ray. I'm not exactly sure. But when you came back in here, if the abscess was some type of acute abscess and maybe your gum was swollen, it's kind of difficult for me to put it in layman's terms. Clinical terms, it's a little bit easier, but then it might confuse you a little bit more. But for whatever happened, sometimes you have bacteria in there and the bacteria remains dormant. And when that right stimulus comes along, it will trigger the bacteria and it'll let you know it's there. Sometimes that trigger, and you mentioned California, I know that different changes in pressure, the bacteria respond to that. I can't count how many patients of mine will come back after being on a long plane flight, and that's when they'll tell me that that's when they noticed a problem in their mouth. You could have hit it just right when you're eating something. There's a lot of little variables in there, and it's difficult for me to put my finger on what exactly is going on, but things can and do blow up overnight. I've also had patients where an infection will show up on an x-ray, and the patient doesn't even want treatment. They'll tell me that they've had this crown for 10 years, they've had this abscess for 10 years, and they'll tell me that they're not touching it. And then I've had them 2 weeks later, found out they went to the emergency room because it just blew up overnight. Sometimes just the way the brain processes information, the fact that the patient knew that the abscess was there may have been the triggering agent. I really don't know, but they can and do blow up fast. They can. More likely than not, you've had it for a while. It just remained dormant, and you just weren't aware that it was there. And then finally, it just kind of blew up on you. And depending on what you're looking at, for a dentist to say that they don't want to touch it, we do get those. I do have some cases where a patient's really swollen, and the dentist knows that. When you're at a general dentist office, they usually have a lot of people in their chairs. They're usually pretty booked up. And it's easier said than done for them to go in there and to just kind of anesthetize things, because this is something where you really need to take your time with. And they may not have had the time to treat you the way that they knew you needed to be treated. And they may have referred you out if you were referred out. But I'm not exactly sure. I'd have to really see the abscess to know why that happened. People all the time with very good home care, problems can and do arise. You can get, I know that studies are showing, they've done studies where they've done crowns on perfectly healthy teeth, no fillings, no cavities, and between 15 and 19% of all the teeth that they crowned ended up dying over time for no reason whatsoever. So even if you have good home care, those teeth can die. And if you do have a dead tooth in your mouth, a lot of patients think that, well, it's not causing me any discomfort. My best option is to leave it alone, and that's not the case. Your best option is to get that dead nerve out of there. And also, too, in the defense of any dentist in the past that may have looked at you, nothing may have showed up. If we look in a patient's mouth, if we look in patients' mouths, and they have a lot of crowns in their mouths, and we don't see any type of pathology on the x-ray, and nothing's implied, it's not really practical for us to go in there and go through 8 clinical tests on every tooth in their mouth every single time they come in, especially if things look fantastic on the x-ray. As soon as we see the first red flag, that's when we start testing things out. And we try to find out if something is wrong, and that way we can inform the patient and we can address it before it becomes a problem such as you had. And my best guess is that whatever infection you may have had in there, it may have just simply been overlooked. To no fault of anybody's. And then finally the right stimulus came along, and maybe that was that plane ride and the bacteria that responds to pressure, and that may have been what happened.
Yeah, well, thank you so much, because it sounds so reasonable.
Yeah.
You got it.
Well, Patricia, we really appreciate you calling in this evening, and we hope that did kind of help alleviate some of your concerns and your questions. So we always appreciate the calls.
Yeah.
All right, have a great evening.
Everything's great now.
That's good. That is good. Good to hear. Thank you so much. All right. Well, we do need to take a break. I know some of you are online with us, but hold right there. We're going to take a break. When we continue right after these messages, we'll talk more with Dr. Horwat.